The clock is ticking for these nurses in some private hospitals to reach an agreement before thousands of nurses go on the picket line. As early as Monday is when we could see this strike with these nurses. Now, we know that nurses say strikes come down to really just more patient care when it comes to patient-nurse ratio and a number of other factors. Certainly compensation is also a major issue, but nurses say what happens inside these hospital walls is not adequate enough, and they're looking for more operations to be beefed up so that quality of life for both the patients and the nurses is all around better. An internal memo from Mount Sinai hospitals reveals they're moving forward with strike planning. Ambulances have already been diverted, elective surgeries are being canceled, and patients are being transferred out of the hospital. The memo reads, quote, "In addition, this sadly means transferring NICU babies out of Mount Sinai Health System to ensure they get the care they so desperately need."
Right now, nurses in the neonatal ICU are carrying double, okay, of sick babies. That's not a safe nurse to patient ratio right now, Mount Sinai. You need to do better.
Strikes have been averted at several hospitals as tentative deals have been reached on increased staffing and significant raises. But hospital heads and more than 10,000 nurses are still in negotiations at Mount Sinai Hospital Systems, Montefiore Bronx, Bronx Care Health System, and Flushing Hospital Medical Center.
It's not just about compensation. It's about caring for our patients. It's about safety. It's about nurse-patient ratio. And right now, Montefiore and Mount Sinai, they are not bargaining in good faith.
For example, the New York Nurses Association says Montefiore is so understaffed there are patient hospital beds in hallways. It's a reason why nurses are turning down an 18% wage increase and fully funded health care for life. Brooklyn hospitals could also potentially join the picket line.
The reason we have not mentioned them is because they have not finished with their strike authorization. We are in the process of doing the same thing at Wyckoff hospitals, and the one Brooklyn will follow.
Both sides say they'll spend the next couple of days on the negotiating table. Of course, we could have some more updates earlier or later on today, I should say, rather. But that strike certainly looming as it's pending as early as Monday.